Today's date, June 11th. Hi, good afternoon. My name is Sam. I'll be the student nurse practitioner that's going to be doing your health risk assessment today. How are you doing?
Good, good. How are you?
I'm doing well, thank you. May I please have your first and last name?
Brandon Lee.
Okay, and Mr. Brandon Lee, do you give full consent to me recording our session for today?
Yes, I give consent.
Thank you. Can you please verify your date of birth?
June 5th, 1997.
Okay. And how would you describe your sexual orientation?
Male.
Okay. And how did we get to your appointment today?
I'm here for my annual screening.
Okay.
For my job.
Okay. And were you accompanied by anyone to your appointment today or no?
Nope.
No. Okay. When was your last annual checkup?
Same month, about last year, about the same time.
Okay. So June of 2024.
Yes.
Okay. And any pertinent health history I should know about?
Other than my back pain, that's it. It's on the lower side of my back.
Oh, okay. Lower back pain?
Yes.
And when did this begin?
Shoot, I mean, a couple of years ago when I was squatting heavy.
Okay. Due to heavy lifting then?
Yes.
About what year? Do you know?
Let's see, 2021.
Okay. Did it radiate anywhere?
Yes, to my left leg.
Okay. And what kind of pain were you feeling? Like pressure?
It was like a sharp pain whenever I would lift or bend down or lift any object. It would just, it's like shooting pain.
Okay.
That would go to my left leg as well.
What alleviated the pressure, or like what helped with the pain?
They told me to just give the weightlifting a break.
Okay.
So I decided not to lift for a couple months.
Mm-hmm.
The pain on the left leg started going away, but it is still there.
Okay. But you didn't take anything?
They prescribed me a medication. It was a muscle relaxant, Flexeril.
Okay. And are you still taking that?
No, I've been off of it for years now.
Okay. And how's your back pain now?
It's still there. It's just whenever I strain it too much, it's there.
I see. Okay. And we're still weightlifting.
Yes.
Okay. Besides the back pain, any past medical history like diabetes, hypertension, asthma that you were diagnosed prior?
No.
Okay. And any history of hospitalization or getting admitted to the hospital? Any history of surgeries?
No.
Okay. How about our immunizations? Are we up to date with them?
Yeah. I have fully vaccinated for the COVID, and then I have the other shots. Is it flu season?
It's not flu season, but you got your last year's flu vaccine.
Yes.
Okay. Are we taking any medications at the moment?
No prescribed medications, just supplements.
Okay. What supplements are we taking?
Vitamin C, vitamin D, magnesium, and fish oil.
Oh, okay. Do you take them daily?
I try to.
And by any chance, do you know the dosages of the vitamins you're taking?
No, not really. It's in the bottle.
You got it. Can you please tell me about your family health history?
Well, my mom side of the family has high cholesterol, and my dad is diabetic.
Oh, I see. And how about your grandparents? Are they still living with us?
No, my mom's mom died of a heart attack.
Oh, I see.
And my dad's mom passed away naturally.
And by any chance, do you know the age?
My grandma was about 65.
Okay.
My mother's side. And my dad's side, about 70.
Okay. And do you have any siblings who have any of these chronic problems?
No.
Any children?
No.
Okay. Thank you. Mr. Lee, do we use any tobacco products or do we vape?
No, no. I try to stay away from smoking.
Okay. How about alcohol? Do we drink alcohol?
Yes. Socially.
Okay. And about how often?
Maybe like once a month.
Once a month. Um, like mixed drinks?
Yeah.
How about caffeine? Do we drink caffeine?
Yes. I take pre-workout
Mm-hmm.
whenever I work out. Maybe like a can or
Okay.
two.
How about like how much is like a caffeine in a can?
It's usually 200 milligrams.
Okay. And you drink about 2 cans.
About 2 cans a week.
Okay. How about any recreational drug use? Thank you. Do you have any life partner or spouse?
Yeah, I have a partner.
Okay. Would you describe their gender to me?
Uh, they're female.
Okay. Do we use any contraceptives at all? No contraceptives. Have we done any HIV or STI testing?
I've only been with one partner.
Okay. But none in the last 6 months or like 5 years. Okay. Alrighty. What job do we do? What are we doing?
Software engineer.
Okay. And where do we are you living currently in an apartment or in a home?
Apartment.
Apartment. And do you feel safe at home?
Yeah. I live by myself.
Okay. Do you exercise regularly, Mr. Lee?
Yes, about 3 to 4 times a week.
Okay, and what kind of exercises do we do?
I sometimes do cardio, running,
Mm-hmm.
running on a treadmill, but mostly lifting.
So we're cardiovascular, and we're still lifting heavy weights.
I try not to.
Okay. How's our appetite been lately?
It's been good. I eat pretty good.
What kind of diet do we eat at home?
I try to eat lots of protein.
Okay. Any fruits or vegetables in there?
Yeah, yeah.
Alrighty. How's our sleep been? Have you been sleeping okay?
You know what? No, it's due to my job. I've been working late,
Okay.
and I usually get like about 6 hours
6 hours? And
on average.
what is a normal sleep goal for you?
8 hours.
8 hours. Okay. 6 hours a day is still quite a lot. What is your faith or belief?
I don't really practice.
Okay. And when you're driving, do you always wear your seatbelt?
Yes.
Okay. And then do we text and drive?
No.
Do you own any guns or anyone in your family who owns guns?
No.
That's good. So I'm going to be asking you some questions regarding just different parts of your body, so I can fully assess and see if there's anything that that's pertinent that so we can see if everything is okay. Okay. Alrighty. Have we had any weight gain or weight loss without trying?
No.
Do you feel usually tired or fatigued? Any low energy levels?
Yeah, actually, yes, recently. I think it's due to my job. I haven't been getting much sleep.
You lack of sleep, I see. Okay. And Mr. Lee, do we wear glasses or contacts?
I wear both.
How long do you normally wear your contacts for versus your glasses?
Sometimes more than 5 hours a day.
Okay.
For contacts, and then when I'm off work, I just take them off, or when I'm working out, I take my glasses off.
Alrighty, and any visual disturbances at all?
No.
No eye itchiness, redness, nothing? Okay. No drainage coming out from your eyes?
No.
Okay. How about our ears? Are we having any ear pain or tinnitus, like when you hear like a noise
No.
in your ear? Okay. Any recent ear infections?
No.
Okay. How about our gums, do you notice that they tend to bleed?
No.
No sore throats, none of that sort. Okay. No difficulty swallowing?
No.
Okay, good. Have you been feeling any chest pain or chest pressure?
No.
No shortness of breath? And you haven't noticed your ankle swelling?
No.
Okay, that's good. Any recent cough?
No.
Okay. How is our abdomen? Any pain in that area? Have you been having any nausea or vomiting at all?
No.
Okay. And how's our bowel movements?
Like sometimes daily,
Mm-hmm.
and sometimes every other day.
And that's normal for you.
Yes.
Have you noticed any blood in your stool at all? Okay. And any frequent or any pain or burning when you're urinating? And do you feel like you have to pee more at night or any
No.
issues like that? And no blood in your urine as well.
No.
Okay. And besides your back pain, do you have any joint pain or stiffness that you've noticed?
No, just my back pain.
Okay. Any new rashes or moles that you've noticed around your body? None of that? Okay. Any hair loss?
No.
You do look like you have a good amount of your hair on your head. Any headache or dizziness that you've noticed?
No.
Okay. Numbness or tingling in your arms or in your lower extremities at all? No loss of balance?
No.
And how has your mood been lately?
I would say I've been more irritable.
Okay.
Maybe it's because of lack of sleep.
Oh, maybe.
Yeah. But typically, whenever I get 8 hours of sleep, I'm fine. It's just when I lack sleep, I tend to notice I get in a bad mood.
Okay. Any feeling of anxiety or depression and no thoughts of self-harm? Have you noticed any changes in like you having to feel more thirsty, having to urinate more? Okay. Um, and have you noticed that you've been getting bruised easily?
No.
Any swollen lymph nodes? None on your neck?
Nope.
Okay. And are you allergic to any foods or any environmental triggers that causes any allergic reactions for you?
Well, I used to have a peanut allergy when I was a kid, but I think I outgrew it.
Okay. What happens when you eat nuts when you were younger?
I get rashes and hives all over my body.
Okay, but no history of anaphylactic shocks, none of that. And have you had nuts before? Or I'm sorry, have you nuts since?
Eating nuts?
Eaten nuts, yeah.
Yeah.
And no reactions.
No.
Okay. Looks like we have everything. Let me just double check. Okay, I'll go ahead and file these and send them to your provider, okay?
Okay.
Thank you so much for seeing me today.
Thank you.